So navicular anatomy. So navicular anatomy is it's an oddly shaped bone. It's basically like a kidney bean. It's an arch with stress concentration at the keystone, so right in the middle. Much like the fifth metatarsal, it has an area where there's a paucity of blood flow. So there's a hypovascular area kind of in the dorsal aspect that can be seen in a certain percentage of patients. And this is the area which usually gets the fractures. So you have a combination of high stress, so a mechanical problem plus a vascular problem. So I think it's useful to classify a lot of these stress fractures because you'll see a lot of them in the foot and ankle in particular. Into this was I thought a well done approach looking at low risk, which are the compression fractures. So like your first to fourth metatarsals, medial tibia, calcaneus, and these are the stress fractures that, in theory, you just protect them a little bit. You put them in a boot, you take away the stress, the fracture will heal. I think that is in contrast to the high risk stress fractures. So these are stress fractures where the bone is in tension. And these include your navicular and your proximal fifth metatarsal. So these are the ones that if you just kind of protect them in a boot, probably have a slightly higher risk of non-union or going on to a worse prognosis. So to speak about navicular specifically, there are classifications out there. The grade 1 is just the dorsal cortex or just edema. 2, the fracture extends to the mid-body, which is that second picture. And 3 is completely through. And at least in this study, the average time to heal is about 4 months. They recommended to treat the grade 1s with rest and protected non-weight bearing, and grade 2s and 3s with ORIF. So the thing about navicular stress fractures is sometimes it can be a little bit harder to diagnose. A lot of times they'll complain of kind of vague anteromedial ankle pain. You kind of talk about the end spot. The first one I saw in a professional basketball player, I totally missed. He said he had basically jammed his ankle